So now we're gonna shift gears a little bit. I'd like to introduce you Chris Jaklitsch from the VA, and he's here to tell us about the effort and the process they went through to look at plain language communicating.
Okay, my name is Chris Jaklitsch. I work for the Spokane VA. I'm here to tell you kind of the crazy process that I went through as far as the great, thank you. As far as the plain language and common terminology and notification process and those type of things that we've been going through. Just FYI, it's an ongoing process. So we started this a year and a half ago, and we're still going through the process right now. So to jump right in. All right, so I got there about a year and a half ago, and I got 13 complaints the first week. What's going on with these stickers? And basically on all our phones we have, and I'll pass these around. So we have these little stickers on all our phones that go over our responses. And they said, you know, what's going on with these stickers? Why can't you figure out these stickers and get us new stickers? I'm like, I can get you any stickers you want. We can have Mickey Mouse. I can have whatever you like. I can get you stickers. My kids, I got a 5-year-old, 8-year-old. I can bring it from home, no problem. I said, no problem. You know, let's figure out what you got and what you're using. I put that welcome to Baba because that's what I call it, Baba. Said, no problem. We can replace those. What are you using? I said, what do you mean? I'm like, well, what standards? What are you going off of? I'm brand new to your facility, so you know, where do standards come from? What are the other hospitals using? VAs? Like, what are you guys using? How did you get to the point that you're at right now and the stickers that you have? You just have some. On the old stickers, there was some common terminology. There was some random numbers. It was just a conglomerate of just random things on the sticker. So that was the first question: is help me help you. What do you want from me? What are you using? So we kind of went through the what's out there. I came from FEMA over in Region 10, and one of the we were going through and really wanted to use was plain language, common terminology. So everybody's on the same page. Everybody knows what you're talking about when you're talking about it. So kind of went through each one. Plain language, you know, the code words don't equal expected response actions. So just because you have a code doesn't necessarily mean that it's going to produce exactly what you think it might. How many color codes are out there? And we'll go over that in a second. Confusion on color codes, it delays responses. Period. What color is code yellow? What do we do for that? I don't want you to think. I want you to know. I want you to know on a heartbeat, because your response is going to make the difference on how we effectively have continuity of operations in our facility. Threat or injury, potential for patients and staff. Your delayed response, well, what does that transition to? We have a hospital, so we're treating patients. So the longer you delay your response, the worse off my patients are. That's a terrible thing. And we looked at color codes. You know, staff are used to color codes. They've had colors forever. I've had I don't know how many staff come up to me and they're like, I don't know why you're trying to change this. I know you're like 16 and you just got your license, and but you know, we've been doing this for 20 years the same way every time. I'm like, that's great. I'm glad. Let me show you a better way. And that's what I said. And then codes don't cause panic, right? So if you're gonna say a code of code green, code yellow, Dr. Green, or whatever it is, a lot of the patients don't really know what you're talking about, right? That's a great thing. Not necessarily. Not necessarily. Panic is not a bad thing all the time. It gets people moving. You just need to tell them what direction to move in. Savior. I put this on here because Jennifer Lord, if you do not know her, she's an amazing person. She's wonderful. I literally went up and I hugged her, and she's like, why are you hugging me? This is kind of awkward. I'm like, well, because I'm literally going through this process right now as we speak. How many of you went to the WISHA conference just recently? I guess last year. Anybody? 2, 3, 4? So what's funny about that real quick in the story, and I'm glad you went over the evacuation procedures, because we're in the middle of this. If you went to the one breakout session was color codes and common terminology, and they had a code red, and everybody sat here, and nobody knew what to do. There were some people that knew have a code red as fire. Some people didn't. Some people didn't know really what to do. So literally everybody sat here till this one person came in and said, hey, it's time to evacuate. It's a fire. Go. Like it was interesting to see that. So anyway, Jennifer Lord, like I said, at the same time, I went to this WISHA conference, and I'm like, this is amazing. You're literally going over and you've done a ton of research on color codes, and I'm literally going over this process as we speak. So I got a lot of information from her. I told her, you know, what are we trying to go through? We're going through the notification process. We're trying to figure out whether we want common terminology or plain language or color codes, like a unique color code system for our facility. And the amount of research that she did is just amazing, and we'll go through that. In fact, let me pass around. I only have 20 of these, but it'll make a difference, and you'll get to see these. Here you go. Might have to share. Okay, and I put her information here as well. She's the training and exercise manager for Northwest Healthcare Response Network. So, what do you use? Daryl, what do you use? What's a code yellow? Hazmat. Dean, what's a code yellow by you? Point made. Who else? Ken. Don't have one. Gotcha. Okay, so the point made was I asked 2 different hospitals what their code yellow was, right? And they have 2 completely different things. Why is that a problem? We have doctors and nurses and, I mean, moonlighters that go back and forth to hospital after hospital. We even heard of, I was talking to contractor Holden Cook, and I'll introduce you in a minute. We were talking about a hospital in California who, there was a code blue, and there was a nurse that happened to be from a different hospital. She responded to a code blue. What's code blue most of the time? Respiratory, cardiac arrest, stroke, something like that. No problem. I think she was even ACLS certified. She was going for it. She's like, I got this, right? And she shows up, and she's in an active threat scenario. Didn't know it. Because her code blue is respiratory arrest. Well, not at this hospital. It's different. So that's what plain language does for you. It tells you exactly what you need to know when you need to know it. So let's see. So I put a couple facts up here, and I underlined the big pieces of it, and you can read it. Response actions are often uncoordinated because of code words. Contradictory disaster code nomenclature carries a greater risk for response confusion. That's not what we want. We don't want to be confused during a response. That's the last thing we need. We need to be collective and together, and we need to know what we're doing as fast as we can. Organizations have recommended standardized language. There's a couple different, as far as the VA is concerned, there's 2 codes that we can no longer have as codes. One of them for us is an Amber Alert. It has to say Amber Alert all the way across. It can't be code white, code yellow, code pink, whatever it might be. It has to be Amber Alert because that's what people know is a missing person out in the community. We even use it for if there's a missing child. We don't really serve children, but at the same time, if there are children in our hospital at the time, that's what we use. And then active shooter, active threat is the other one. We have to use active threat. We can't use code, I don't know, or code silver. Quick story with that. I was driving down, it was Bigelow Gulch one day, and one of the DOT boards said code silver. And so I immediately started looking around. I'm like, oh my gosh, somebody has a gun, because it was back in the past. That's what I knew, right? I'm looking around. No, it's not. Anybody know what it is? Right, missing vulnerable adult. Point made, right there. You know what I mean? I'm looking around for somebody that's going to shoot me in my car, which is really awkward. But at the same time, then all of a sudden it's not. It's a missing person. I should be looking for, somebody wandering off, maybe like Ken back there, not paying attention. Gotcha. All right, so this is what I'm passing around to you. She did such a great job of doing all this research, I pass this around to you because it goes over a ton of different hospitals and what they use as far as their codes. You know, as you can see it right here on the side, it's, you know, code red pretty much is fire. I mean, that's usually what it normally is. Code orange they have is a hazmat. That's normally what it is. Maybe not in your case. Code blue, same type of thing. But as it goes on, it just gets muddy. They're all over the board. And that was the point, is just, you know, they don't match. There's no standardization across the nation for color codes. I don't understand why. I think that would be an amazing thing. We do have the WSHA codes. We have the WSHA guidelines. Not everybody goes off of those, though. I mean, a lot of us do, or a lot of you all do, but we chose to go with plain language. It just makes sense. So what I do, I put together a proposal for our staff and our director, and this is not easy. If you were going to start this process, I hope you have better buy-in than I did, because it was tough. I went through, I don't know how many different committees. Honestly, I couldn't even put a number up here for you. Multiple, probably 5, 10 different committees talking about this, going through the process, bringing up the research. I did multiple presentations for everybody from the lowest level to the director. I got the director's approval twice. You know, I mean, it came back and he was like, yeah, this is great, let's go with it. And then he had a bunch of questions. Staff came to him behind me and said, you know what, I think this is a terrible idea. He's like, well, let's relook at this. Let's look at this process again, and which is fine. I mean, it's his call. So let's look at it again. If it's not the way you want it, if it's not going to work for us, then it's not going to work. Period. Let's not force something that's not going to work for us and we're not going to go with. So I thought that was a great process and good on him. So I developed a proposal and a bunch of support documentation, just like what's in here. Like I said, presented the idea. EMAC is, it's funny, right? Common terminology. So Emergency Management Advisory Committee is my committee at the VA. And so that's where I propose things first, and then from there, that's where it branches out into the different committees, that type of thing. So I went over all the pros and cons that I thought, and then we had a vote. And we voted right there. And that was an all right process. And then I sent out a voting process to a lot bigger group of people. And that got a lot more buy-in. I started getting questions and comments, and like I said, the 16-year-old thing came up. It was great. I hear it a lot, which is funny. But the voting process was great because at the end, especially if in Outlook, if you haven't used it, it's awesome. I got all his results, and I said, when they said, you came up with this process, I said, no, you said this was a great process. Now we can go with it. And that's what I brought to the director. I said, out of all these committees and all these areas that we went out to, I had everybody's buy-in. I took all their feedback. We adjusted things the way they wanted, and we came up with results. And here are the results. So for him, it was pretty simple. He said, wait, did you get buy-in from all the different service chiefs? And he went through his, all the executive levels and that type of thing. I said, absolutely. And that was it. That was kind of what made it go through. He said, well, what are you going to do next? Like, how does that work? So he approved on the second time on June 22nd, 2016. And we started implementing the common terminology, the plain language on everything, right? What do we have? What do we need to change? So all this started by a sticker, just so you know, right? All this by a sticker. Like, you got to be kidding me. This is a huge process for a tiny sticker. And so we looked at simplifying our procedures to take I love this because take the emergency out of emergency management, right? It's not an emergency if you know what you're doing. If you have a process and you have it all in place, it's just procedure. So there was a couple different things we did. And I'll pass some of these out. Here you go. Sorry. Okay, so there's a couple different things we did. We put badge backers. So we went through all of our old codes and we made them into plain language. And then we put it on a badge for everybody, right? So as I walk through the hospital, it's fun because I say, hey, what are you going to do in a medical emergency? They're like, what? I don't know. I'm like, sweet, do you have a badge? Like, yes. Let's look at your badge. Let's go through it. It tells them exactly what they need to know, when they need to know it, if they forget it. Everything is correlated, right? So I went from the stickers to the badges. I did an overhead announcement policy, which is this right here, and basically says what they need to know, how they need to know it, and what to say if they're the one presenting it over the intercom. And then we went to active threat magnets. This was part of another implementation plan, but instead of using a code for active threat, we went with plain language on the magnets itself. So, which is actually a really good idea. We're the federal government, so we got the federal magnet. The magnet doesn't work great. I hope you get a better magnet than I did, but it works. It works. That's right. We got the lowest bidder. No. We did a good. They did a great job for us. Actually, it was the company we went with was awesome. She worked with me tremendously. We went back and forth 100 times, and it's the same company that I'm going to introduce you to because they're still working with us. That's how much I like them. The magnet itself, it does stick on a lot of things. It's just sometimes some of the cheap stuff that we have now, some of the government stuff that we've got, just didn't work. So, all right. So hospital response procedures. Where are we going from there? So we did the the stickers and the badge backers and the overhead announcement policy. So every one of these is correlated. And the next piece of this is, the response guides. So these I'm doing as response guides. So basically what it is, it's going to be your first 5 steps in any type of emergency, right? So all of our responses, it'll be like the first 5 steps. Nothing in depth. It's not going to be, specific to any service. It's going to be an overall process or procedure. If you look on these, can I hold this up? Our overhead announcement policy. So every one of these line items is going to be one of the flipbook pages, right? So that way when they say, what's a facility alert? What does that mean? Awesome, let's take a look. And I'll refer to it on here. And it'll be in here, and it'll be on their badge. So everything correlates together. So I'm working with Holden. Holden Cook is in the back. He's with Guest Communications Corporation. It's been phenomenal. We've known each other now for about a year or so because we've been going back and forth about this plain language, that type of thing. So I'm implementing all the plain language and all my responses in these simple flip books. This book right here will be in every cubicle, every nursing station, every lobby, and just every area, right? Because it makes sense. If it's not there, no one's going to use it, no one's going to look at it. So when my team's going around and we're training people, I'm going to say, hey, what do you do in a fire? And they're going to be like, I don't know. But this is great. Let's look at your book. And we'll take out their book and we'll go through the first 5 steps. What's PASS? What's race? What does that mean? How does that work? And it'll be right here. That's that one. Where do we go from there? The next step. These, some people use as their response guides, some of the hospitals and that type of thing. This, to me, is a service-specific emergency preparedness plan. And that's what I'm going to do, is every service, every department, and every building will now have their own service-specific plan. So let's take the medical emergency, and let's break it down even further. What is your service going to do? How is your service going to respond? Where are your blue buttons? Do you have buttons on the walls? Do you call a certain number for your medical emergency response team? How does that work? Maybe for a fire. Where are your assembly areas specifically? Let's list them. Where are your fire extinguishers, your pull stations, all those type of things. All that information is going to be specific to each one of my services, and that's what they're going to have. On one side, it has their bomb threat card, and on the other side, it'll have pertinent information and numbers for their for their service only. So this is very specific. So it's taking it from, you know, the stickers to the badge backers to the overhead announcement to the response guides, and breaks it down even further into here. Now, and that's what Holden Cook back there is helping me with literally as we speak. So we're literally going through every single one of the responses, building it one by one. He's been great. He's been dealing with me, which is very patient, and I appreciate that. But I wanted to bring him in and show you these because as I bring these around, a lot of people have liked these. I like them because it makes sense. They're simple. It's very, very easy. And down here you can see all the different, there's a bunch of them, but there's different colors and different ways that they can do this. I picked one that looks kind of like this, but it has, actually it's this one right here. And you can put any information on there that you want. Let's see. So, completely custom and adaptable to the needs of your facility. I like Burger King, right? Have it your way. Whatever you want, however many envelopes you want in here, it's great. You can do it. They'll do it for you. And then what's also great about it that I love is that, you know, what if your process changes? Then you have to go back and get a whole new book? Nope. Because all these things, they're just paper. You take the paper out, you already have, once you work with Holden, he'll give you the template, and you just type in the information that you want and change it, and then issue out the new card. And the services put their card in there, it's all done, right? Because the problem with all the ones that are paper is that you have to redo the whole thing, right? That's what we had before. I threw out boxes and boxes and boxes of 2008 versions of color codes and things like that we have had in our facility because they had changed. So I couldn't just print out one little piece of paper. I had to do the whole thing again. So it was like a flip book of all paper, and to do that it was going to be just crazy and chaotic. So I didn't do that. Designed to quickly guide you in emergencies. It's a flip book. So easy. What do I do in a medical emergency? What do I do in a fire? Well, it's easy. It just says right there on the little tab. You can go right to it. It tells you your exact procedure quickly. Easily updatable, like I said, and cost effective. It's real easy when you're just updating that one little page opposed to a whole book. Like so with the paper card, same thing. Professional layout and design. I like this because I can put this, I'm going to put these in all my services, and you can buy like this little, I don't know, clip holder that goes up on the wall, and that's where it's going to be. And I can put it in the director's office. I can put it anywhere throughout the whole facility, and because it has a professional look to it, it's not going to make a difference. It doesn't look trashy. It doesn't look like it shouldn't be in that area. They're very professional looking, which is really nice. And then, like I said, just consistent customer service. I've had Holden in my office for a couple days now. We've been sitting around going over these things, and like I said, we've been working together for a whole year now, and he even came down to help me one-on-one with this process. So, and he can definitely do that for you guys. I'm sure we'll work it out, and he's just been great. So I just wanted to bring that to you all. That's about, future goals. So for us, what we're doing with this is, so now we have plain language. We're revamping our whole emergency operating plan to incorporate the plain language, how that's going to work, how people would respond, that type of thing. A lot of training, a lot of coaching. That's what it's going to take. You know, sometimes if you're implementing a whole new process, it just takes a whole lot of exercises and training and that type of thing. And this is definitely one of those. The thing to remember is when you're putting out common terminology or plain language, you're not only just putting out the, say, like, I don't know, fire response. You're not just saying fire response over the overhead. You're given instructions. So it's not just the code. It's just not the one term. It's everything. You're telling them what to do, how to do, and when to do real quick in the first couple seconds that you're doing an announcement. We're trying to expand and get an app on our phones. Once this is done, once our emergency operating plan is done, And then we're also going to have an icon on our computers. So if they do have power, which I'm pretty sure that we would, we have an amazing capability for power, they will be able to click on the icon on their computers at any given time. So it makes it easy. Electronic, if you're an electronic person, or if you like the paperback. And then just for us, respond effectively to any and all incidents, always the #1 goal. And I think with all these different changes and things and making it plain language, you'll know as fast as anybody whatever is going on, whatever the response is, and you can move quickly. And that's what's important. So. And there's my contact information if you want to know more or come by and check us out and see what we're doing. Like I said, I'm working with Holden for the rest of the week, or I guess today and part of tomorrow. We got some things in the back. He's going to show you some of the ideas that we've come up with and some of the other books and things that some of the other hospitals have gone with. So you can check that out as well. I will have to leave. I will leave all my information and everything back there with Holden. We're actually running an incident with our facility right now. We had some flooding in one of our clinics, had to shut it down, and we have a mobile operations. We'll have a clinic out of a bus right now, and we have a command trailer going on. So if you want to check that out, come down and second a wall, and I'd love to see you guys. If you want to help out, great. So anybody have any questions? Yes, sir. Yes. Yes, sir. So he's talking about on the cards itself, F9, F11. So for us, don't tell everybody, but no. On our keyboards, you can press F9, F11 at the same time, and it calls our police automatically. All our laptops are set up the same way, that type of thing. Like it's a great system, and it's our links notification system. And if you don't know what links is, I would love to give you information about links, because we only use 10% of this links notification process, and we are trying to expand. I should have put that up there as well. They've got everything from face recognition programs to the F9, F11. You can, all the different buttons that are around the areas, around the hospitals. So if you have a code blue button, that's kind of a link system. So you can have a decon button. You can have any type of these buttons that you wanted in all the different areas that you want them, and that's part of the link system. So we're actually going with that as well. Did I answer your question? Right. Well, and another thing too with these, I don't know if you saw this, on one side, sorry, I'm trying to hurry. On one side you have need help. So say you can't call the police, you don't have that capability. What's cool about our keyboards though is even though the computer's not on, if you press F9, F11, it'll still call them. But anyway, the need help is you can put it up in a window, underneath a door, something of that nature. I lived in Colorado and I was there for Columbine, and it was terrible. So, just I take it really seriously as far as active threat, active shooter. So I was really looking at what could help our staff. And then the other one is all clear. So my police brought this up. They said, well, if we come around and we're knocking on the doors and we say, hey, it's all clear, you can come out. They don't know that we're actually the police. We've had people talk about, well, should I slide my ID underneath the door so that way I know that you're the police, that type of thing. So we came up with this idea, and Holden actually came up with it and showed us, and I thought it was amazing because you can actually just slide that under and be like, good to go. And my police know, and they're trained now to be like, oh, great, we're moving on. We're going to help out the next group, right? So, any other questions?